For the first time since surviving severe COVID-19 last March, Matthew Cardinal went back to the Regina hospital that saved his life.
It was hard for me to go to the hospital. It was very hard. Going to a place where you're dying, basically, it was traumatizing.
Left with long-haul symptoms, his future with the virus remains unclear, as so many others move to put this pandemic in the past.
The direction we're going in now, I wouldn't say we're nearing the end, but I think there are many ways in which we can see the end.
That's not necessarily the end of the world. We spend every day of our lives living with viruses that once caused pandemics. Influenza, the 1918 Spanish flu, was the deadliest pandemic on record, but thanks to herd immunity and medication, it fizzled out. In the late 1980s, there was HIV/AIDS, but modern treatments have made it a manageable disease. 2009's H1N1 outbreak is often called the forgotten pandemic, thanks to technical advancements, surveillance, and treatments that quelled it so quickly. Montreal microbiologist Donald Vinn says really only smallpox and possibly SARS, which hit Toronto hard in the early 2000s, have been eradicated.
What's likely going to happen with SARS-CoV-2 may be similar to what we saw with the 1918 influenza, which is that there was a peak amount of activity over a certain number of years that eventually decreased through a variety of both viral biology and medicine and public health measures,
leaving us to coexist with COVID. To get there, experts say we can't repeat history. We need to focus on our failing healthcare systems and build up capacity, communicate public health measures clearly to further avoid pandemic fatigue, put in place proper data collection, which we've failed to prioritize, and continue to vaccinate, test, contact trace, and surveil.
As much as many people want to believe this is over, this is not over. There will be subsequent waves. The question here is, how and to what extent will those impact us in Canada?
The answer may lie in what we've learned and how we respond as a collective. Mauracher, Global News, Toronto.